How's everybody doing? Good. My name is Lisa Orloff, and as you heard before from the introduction, I am the founder of World Care Center. And I got involved with World Care Center. I've been lucky enough to have 2 careers in my life. My first career was a fashion designer in New York City, and my second career is as a disaster manager working with World Care Center. And the topic of today's talk is near and dear to me because I had the opportunity post 9/11 to work with some of the most caring, compassionate, giving, selfless people that I've ever met in my life. However, at the end of working with them, I could see that they paid a price for their caring. And so we're going to talk a little bit about that. I want to frame this discussion that we're talking about emotional resilience in caregivers and responders, both volunteer and professional, in the aftermath of crisis and disasters. And additional context is the mental health impact of volunteering in disaster settings reports that one of the main resources for external assistance in disasters are community volunteers. Yet, the same report states that volunteers feel the negative impact of their contribution 75% more than official responders, who are reported at feeling the negative impact 43%. So again, context, disaster management. This is a nice, tidy little chart. And it shows the flow, the physical flow of preparedness, response, recovery, and mitigation. It's standard, and it is around really what we do physically in preparation. We put things in place. We, as individuals, create go bags, shelter-in-place kits. Our official responders pre-position equipment and get their teams ready. And then something bad happens, and we respond. And that response can vary from disaster to disaster, community to community. And it can last a short period of time, or decades. And then we go into recovery and mitigation. And mitigation is applying our lessons learned to reinforce our infrastructure so the impact of future disasters are lessened. And again, this is more our physical path. But now let's look at our emotional path through that process. It's a little more chaotic. It's up and down, and there are a lot of factors. So the baseline is blue sky at the beginning of the chart. And then we have preparation, a threat, and our adrenaline starts kicking in. And we start to take action. Maybe we're a little bit frightened, our emotions dip, they're on the negative side, and then we decide to take action. And the action, which is in the green line, and the positive emotions in the red line are simultaneous. But look and pay attention that they're actually separate from resources. So people feel more positive when they're taking action, irregardless of the fact that whether or not there are resources available to them. And then we have ups and downs in the response, recovery, long-term recovery, mitigation, and then going back to perhaps a sense of normalcy with resilience.
We got down there, it was a night shift. There were no identifiable components left of anything that we knew to be a building.
When I entered Haiti at night, I saw piles of bodies on the ground everywhere.
Staten Island was a real mess. Homes were uninhabitable. There was no power.
I'm going to try to evoke some emotion here. I want you to feel what our community feels during these phases of disaster. So listening to that video, And looking at these pictures, how do you feel? Anybody? It's interaction. Come on. Angry. Awesome. Anybody else? Anxious. Afraid. Disconnected. Disempowered. Vulnerable. Helpless. What has just happened? Someone has taken away the things that are most precious to me. I am frightened. I am suffering. But yet, those of us, and there are many of us in this room, that are proactive, what do?
We know that when crisis occurs, that individuals have an instinct to respond and to help others.
I always wonder, what if I hadn't? What if I hadn't jumped into that mess? I probably would never forgive myself.
After a disaster hits, it's essential to be able to not only rely on first responders. You need other people. You need volunteers to step forward. You need other resources to come in.
And now, how about now? Feel any different? Reassured. Anyone else? Energized. Right. Empowered. Whoopsie.
What goes wrong?
Empowered, but not very technically proficient. We're connected. So we know that disasters can leave us initially feeling frightened and disconnected. However, we as human beings have a flight or fight instinct. And when you relate that fight instinct to disaster response, it comes out in volunteering, in stepping up and saying, I am not a victim. I am a responder. I am going to help someone. I am going to connect, and I am going to make sense of what just has happened by helping others. And by engaging the community in feeling empowered, resilient, hopeful, helpful, with a sense of purpose, we thereby are engaging and empowering resilience. People are positioning themselves as resilient rather than being told that they are a victim and they can't contribute. And this lasts for a while with our community volunteers, those that are not professional and connected to consistent resources, because there's not yet a system around a continuum of support for this community. So this may last. However, as we looked at our chart of emotions, things change. The recovery changes. Larger institutions come in, and that local capacity begins to be minimized. And some people are no longer included in the process. Some have to step away.
What goes wrong in most of the disaster risk management initiatives is that they start from the top and they are supposed to go to the bottom. And by the time they reach the bottom, there's virtually nothing left.
A lot of what happened during the earthquake in Haiti, supplies came in, they were hoarded by whomever, they never got to the people.
So what you begin to see is this incredible surge of citizens that are coming together and feeling empowered and feeling very positive. However, their resilience diminishes because they become disappointed, because the reality of disaster response, the timeliness of resources, perhaps even the inequity in where resources go to, begin to set in. In addition, there's little awareness about the emotional stressors of disaster response and the need for self-care and pacing oneself. So what begins to happen, I couldn't find a really great graphic on a drain. I'm sorry, it's a funnel, but pretend it's a drain. These great emotions start to go down the drain. And what you begin to see is that our volunteers and our responders are reaching their peak level of performance and going over the edge. So we have this lovely chart, and it shows us drone zone. Well, we know in disaster management terms that there's a lot of apathy in preparedness. So you might consider that the drone zone or the couch potato zone. Then we have improved performance, and that may be related with an impending event, a disaster, or just having to go to work in the morning. And then you're at your creative calm. So for some of us, especially in the disaster management field, we're not at our best with creative calm. It's kind of like we're in, it's movement, it's action, it's doing. But that's where we are at our best. And this is individual. For everyone, this is very different. What is the key is to know where your zone is. And this is important as an individual. It's especially important as a local leader. Because as a local leader, you hold the social capital of your community. And if you don't stay emotionally and physically healthy, your community will suffer. So we have the fatigue zone. And we can see this happen through the cycle of disaster response. When we start to get into recovery, we can see people become fatigued. Communities become fatigued. Communities that were working together and local leaders that were working together begin to cannibalize each other emotionally. They tear each other apart. They become exhausted, both physically and emotionally. And eventually there's burnout and breakdown, and also we see infighting amongst communities. This is kind of what may represent what we look like. Maybe not externally, maybe externally we look fantastic. However, internally, this may be what we're feeling. All the pressures of caring for people with all the pressures of this emotional trauma. We begin to feel self-righteous, disconnected. We lose trust. We become suspicious. Nobody can do for our community what we can do, so you have to go through me. We suffer things like compassion fatigue and vicarious trauma, which furthers our disconnectivity to both those that we're trying to serve and our own personal lives. So we ask people to respond. We ask them to help others. We're talking about a whole of community approach, but that requires looking at ourselves as human beings holistically. It's not only about our physical well-being, but it's about our emotional well-being. We have to protect that, hopefully to mitigate this emotional trauma, but if it does fall upon us, to recover from it.
Everybody has a part to play in this world, and if you're doing something positive, you're moving in the right direction. What really is left in life if you're not going to help your fellow person?
Everyone has the potential to be a leader. Everyone has the potential to be that go-to guy, that helper, that light in the darkness. Everyone has that potential, and they can actually better fulfill that potential if they're prepared. And that's what World Cares does. They get you ready for anything.
So that was not intended to be a shameless plug. However, it is meant to reinforce the need to step up as a ready responder, to reinforce that this is going to happen, it does happen, and we need it to happen. However, a big component is this emotional well-being and the resilience of the community. And it starts with individual resilience and the knowledge that really bad things can happen if you don't take care of yourselves emotionally, and realize that as caregivers, as responders, as those helping others, this can befall upon you. I love superheroes. Love them. Batwoman. Is there a Batwoman? Maybe not. Catwoman. Supergirl. Wish it was Superwoman. Rosie the Riveter. However, we're more vulnerable than that, and we need to take care of ourselves. We need to be aware that disaster response not only, and crisis response of any kind, the work we do day in and day out, not only poses physical hazards, but emotional hazards. We have to identify what our triggers are, what our vulnerabilities are, and what our strengths are, as well as our limitations. Self-care is absolutely critical. We as caregivers, service providers, disaster responders pride ourselves in working excruciatingly long hours without a break. And that contributes to the demise of our health. We have to stay connected to our lives and continue to do the things that make us happy. Exactly. Often we find that our work, sometimes we can't bring home or discuss. So while I'm saying stay connected, and we see that it's very important, we can also have a buddy. As a gentleman, his name is Chaplain Jack Poe from Oklahoma City, and he tells a story about when he was a young cadet, that they were going into a very gruesome situation, and he turned to his fellow recruit and said, I'm not sure that I can handle this, but I really don't want to tell anybody. How about you and I buddy up? And 40 years later into retirement, as he's helping with 9/11, he's on the phone every night with his buddy because he's working in the morgue. And that was the only person that he could speak to that helped him keep his sanity, that he could share those experiences with. I have a buddy, and my husband thanks God every day for my buddy so that I can call him and get his help. Journaling. Yeah, who journals? Anybody journal? You ever look back into some of those pages and go, how come I'm doing the same thing over and over again? Right? It's important to keep a journal. It's also important to read back, right? And see how far you progressed. Another thing is we as human beings always go toward the negative. I didn't do enough. I couldn't help that one individual. I helped 19, but that 20th person I couldn't help, that's what sticks with me. So we have to refocus. We have to refocus on those that we've helped and the good that we've done, and validate ourselves, as well as those that work for us. And lastly, know when you need help, and don't be ashamed or afraid to ask for it. So life is a journey, and so is resilience. Sometimes you're very resilient in ability to be Superwoman, and sometimes you're not, and that's okay, because it's a journey. But we need to take care of ourselves, and we need to protect our potential. Thank you for your time today.